Hello and welcome friends to the Med Project, and today's we are seeing about the definition of neoplasia and difference between the malignant and benign tumors. So first of all we will see about the word neoplasm, which means the neo means new and plasia means growth. And definition of the neoplasm: it is an abnormal mass of tissue the growth of which exists and uncoordinated with that of the normal tissue and persists the same excessive manner even after the cessation of the stimuli which has to be evoked to the change. That means neoplasia is nothing but the abnormal mass of the growth, abnormal mass of the tissue, the growth of which exists and uncoordinated. That means it have the uncoordinated growth as compared to the normal tissue and persists in the same matter. That means the growth is persist in the same matter even after the cessation of the stimuli which has to be evoked to the change. दैट मीन्स अगर किसी टाइप का टिश्यू है तो हमने उसे बढ़ाने के लिए किसी टाइप का ड्रग्स प्रोवाइड किया है, या मीन्स अगर हमने उसको कुछ स्टिमुलेशन दिया है उसके ग्रोथ के लिए और फिर वो बढ़ता ही जा रहा है और आफ्टर आवर गोल कंप्लीशन ऑफ आवर गोल हमने वो जो चेंज किया था या फिर जो उसको स्टिमुला किया था वो स्टिमुला भी हमने निकाल लिया, फिर भी वो टिश्यू उसी तरह से ग्रोथ कर रहा है, तो उस पर्टिकुलर टिश्यू को हम न्यूप्लासिया कहते हैं. दैट मीन्स the it persists the same excessive manner even after the cessation of stimuli, even after the cessation of the stimuli which has evoked the change. Then neoplasia, then characteristics of the neoplasm, that's it is the abnormal and excessive growth of the tissue, then it is the uncoordinated to the same type of tissue or as compared to the other tissues, then it is the autonomous and purposeless proliferation of the cells. That are the five important characteristics of the neoplasm, that is the abnormal, excessive, uncoordinated, autonomous and purposeless proliferation or abnormal growth of the cells. Then our next topic of today's session, that is the difference between benign tumor and malignant tumor. So benign tumor does not invade the surrounding tissue, that means it only confined to its place and do not invade to the surrounding tissue. Then malignant tumor, they are able to invade in the surrounding tissue or able to the spread. Then benign tumors are not spread to the other tissue and malignant tumor are easily spread with the to the other cancer, just like an example breast cancer and ovarian cancer. That means the ovarian cancer can be easily spread to the breast cancer and other cancers. Then benign tumor have slow growth and malignant tumor have fast growth. Then benign tumor mostly made up of the normal cells and malignant cells are have abnormal DNA chromosomes and malignant cells are mostly the cancerous cell. Then normal nucleus is seen in the benign cells and nucleus is larger and darker in the malignant. Then cells are not cancerous, that means the benign cells are not cancerous and malignant cells are the cancerous tumors. Then benign can easy to remove and malignant or cancerous tumor are difficult to remove. Then benign tumors are easily recur or treatment given to the or treatment of the benign tumor is easy, and malignant tumors are less chances to be cured. That means treatment chances are very low or we have the low chances to give the treatment to the malignant tumor. Then benign tumor secrete the hormones including benign pheochromocytomas, and malignant tumor secrete the substance which causes the fatigue and weight loss. Then benign tumors can be treated with the surgery and malignant tumor can be treated with chemotherapy, radiation therapies, immunotherapies treatments and surgical interventions also. Then benign tumors have a little nucleus is little and nucleus is larger in the malignant tumor. Then 12th point is benign tumor rarely it show the hemorrhage and necrosis and malignant tumor mostly mostly show the hemorrhage and necrosis. Then in benign tumor growth is limited and in malignant tumor growth is indefinite growth, that means it have the uncontrolled growth. Then benign tumor are regulated and capsulated, have a regulated and capsulated surface, and malignant tumor have irregular and non-capsulated surface. Then benign tumor attach with the deep surface of mucosal lines or organs, and benign tumors are not attached with the deep surfaces, they are superficially, and malignant tumors attach with the deep surfaces of organs or tissue. Then benign tumors have slow growth and malignant tumors have fast growth, and no metastasis is occurs in the benign tumor, or and metastasis is easily occurs in the malignant tumors. So these are the 17 important points for the difference between malignant tumors and benign tumors. It is the important question for 5 marks in pathology and mostly asked in MUHS nursing exams. So if you like this video, so please share this video with your friends and subscribe to my channel. Thank you, friends.